Hello everyone, welcome back to another recall session. So today we're going to discuss with you about the physiology recall questions of NEET PG 2020. So let us start discussing the questions. So the first question is, a person develops headache and breathlessness on a trekking expedition following a rapid ascent to over 3000 meters above the sea level. Which of the following is not used in the treatment of this condition? So, rapid ascent is happening here above 3000 meters, the sea level, and there is a headache and breathlessness issue. So, this scenario is suggestive of acute mountain sickness or acute altitude sickness. So, they are asking that which of the following is not used in the treatment of this condition. So let us look at the options. IV digoxin, no, it is not used in the treatment of acute mountain sickness at any cost. You have to avoid it because digoxin is the drug that used generally for the heart failure, not for the acute mountain sickness. The next option is descent to lower altitude. Yes. Administration of oxygen. Yes. Tablet acetazolamide. Yes. So the thing that is not used in the treatment of this condition is IV digoxin. So the answer here is A, IV digoxin. The next question is ventilation perfusion ratio is equal to infinite. Holds true in which of the following conditions? So they are asking about ventilation perfusion ratio is equal to infinity. That means there is no perfusion. So the perfusion is equal to 0. Means perfusion is not happening. So that means it is actually dead space. Okay. So ventilation perfusion ratio is equal to infinity. That means it is equal to dead space. Option number B is the answer. Let us look at the other options. Foreign body obstruction in bronchus. No, that will not happen. When oxygen and carbon dioxide ratio is equal. No. That means respiratory quotient is equal to 1. Not the it is equal to infinity. Ventilation perfusion ratio. The pressure of oxygen of alveolar air is 159 millimeter of mercury and the pressure of carbon dioxide is 40 millimeter of mercury. This one is also completely wrong. Okay. So the answer here is equal to the dead space. The next question is prolactin level is highest during maximum level of prolactin is seen during the pregnancy and immediate postpartum period. Okay. So prolactin level is highest during 24 hours after delivery. The option number B is the right statement. 24 hours after ovulation, no. Rapid eye movement sleep, no. After running for 1 hour, no. Okay. So the answer here is 24 hours after delivery. The next question is C wave of jugular venous pressure represents. C wave of jugular venous pressure means tricuspid bulge into right atrium during isovolumetric ventricular contraction. Okay, this is the meaning of C wave of jugular venous pressure. So the answer here is tricuspid bulge into right atrium during isovolumetric ventricular contraction. Okay. The next question is the protein in the glomerular basement membrane responsible for charge dependent filtration is protein present in the glomerular basement membrane which responsible for charge dependent filtration is actually heparan sulfate. The option number B is the answer, heparan sulfate. The next question is which of the following clotting factors would have decreased gamma carboxyglutamate residue in a patient on warfarin therapy? So clotting factors would have decreased gamma carboxyglutamate residue on a patient with warfarin therapy are vitamin K dependent, clotting factors which includes factor number 2, 7, factor number 9 and factor number 10. Okay. So 2, 7, 9 and 10. So the answer here is A, factor number 2. The next question is which of the following conditions would have the highest levels of ACTH and cortisol? So let us look at the options. Early morning? No. Normal individuals with dexamethasone administration? No, that will lead to decreased level of ACTH. Okay. Addison's disease? No. And the last one is Cushing's disease. Yes, Cushing's disease have highest level of ACTH and cortisol among these all options. So the answer here is D, Cushing's disease. The next question is following complete ileal and partial jejunal resection, the patient is most likely to have. So they are asking about complete ileal and partial jejunal resection. So this kind of resection generally leads to decreased vitamin B12 absorption. Okay, because vitamin B12 is mostly absorbed from the jejunum and ileum. Okay, so the patient is most likely to have B, vitamin B12 deficiency. The next question is respiratory distress syndrome is due to defective. Simple, straightforward, factual question. It is due to defective type 2 pneumocytes. Okay. The next question is which of the following hormones use receptor tyrosine kinase signaling? So receptor tyrosine kinase signaling is used by hormones that can be remembered by the mnemonic called as insulin, PIFE. Means insulin, platelet derived growth factor, insulin like growth factor, fibroblasting growth factor, epithelial growth factor. Okay, so the answer here is A, insulin. The next question is, what is the site of lesion in Wernicke's hemianopic pupil? Simple, straightforward question. Wernicke's hemianopic pupil has a site of lesion at optic tract. Wernicke's hemianopic pupil means when you show the light on the blind half of the retina, that shows no pupillary reaction, but while the normal side of the retina shows pupillary reaction. Okay, it is also seen in the cases like tuberculosis, syphilis, and tumors of optic thalamus. So the answer here is B, optic tract. The next question is, in which of the following reflexes gastric emptying is delayed when acidic content enters the duodenum? When acidic content enters the duodenum, there is one reflex which leads to delayed gastric emptying is enterogastric reflex. Okay, so the answer here is D, enterogastric reflex. The next question is, a lady presents with vascular injury to the inferior frontal gyrus. Which functional area is likely to be affected? A vascular injury to the inferior frontal gyrus leads to Broca's aphasia, which affects Broca's area, which is also known as motor area of speech in the brain. Okay, so the area is likely to be affected is motor speech area, the option number A. The next question is, a man falls into a deep sleep with one arm under his head. He finds he is not able to move this arm when he awakens. However, it tingles and pain sensation in the arm is still intact. What is the reason for the loss of motor function without loss of pain sensation? Is that in the nerves to his arm. So, there is actually three types of fibers, A, B and C, in the nervous system that actually carries sensations. So, when you have to talk about the fibers which are susceptible for the pressure, then you can remember these three fibers by a mnemonic called as get to basics under pressure. Means A fiber is the most sensitive to pressure than B, and B fiber is more sensitive to pressure than C. So A, B and C is the chronological order of alphabets. So with this we have made a mnemonic that get to basics under pressure. So A is more than B, more than C. So let us look at the options. B fibers are more susceptible to pressure than A fibers. This one is wrong statement. A fibers are more sensitive to pressure than C fibers. This is completely true statement. C fibers are more sensitive to pressure than A fibers. This one is completely wrong. motor nerves are affected by sleep than sensory nerves. This one is also wrong because sensory nerves are more affected than motor nerves in the sleep. So the answer here is option number B. A fibers are more sensitive to pressure than C fibers. The next question is which of the following has the highest oxygen concentration in fetal circulation? So oxygenated blood circulates from placenta to umbilical veins and from umbilical veins it goes into 50% of its portion into hepatic circulation, another 50% of its portion goes into inferior vena cava, bypassing the hepatic circulation. So inferior vena cava has the highest oxygen concentration in the fetal circulation after hepatic circulation. Okay. So the answer here is A, inferior vena cava. Okay. So let us move on to the next question. Respiratory distress syndrome is due to deficiency of. Respiratory distress syndrome is actually occurs due to deficiency of surfactant. And surfactant is made up of dipalmitoyl phosphatidylcholine or dipalmitoyl lecithin. Okay, which is the major part of the surfactant. So the answer here is A, dipalmitoyl phosphatidylcholine. The next question is what makes CPDA superior than ACD for blood storage? CPDA means citrate, phosphate, dextrose, adenine. And ACD means acid, citrate, dextrose. Okay? When you store a blood, there is hole in 2,3 diphosphoglycerate happens. That's why stored blood release less oxygen than normal circulating blood. Okay? When you store a blood with phosphate containing compounds like citrate phosphate dextrose adenine, the following 2,3 diphosphoglycerate is less than plain non-phosphate containing compounds. Okay, so CPDA is mostly used preferably than non-phosphate compound because the fall in 2,3-diphosphoglycerate is less. Okay, so the answer here is the fall in 2,3-diphosphoglycerate is less. So with this, we complete our recall session. So thank you so much for watching and see you in the next one.